Welcome to today's episode, brought to you by the Women in Medicine Summit, a transformational CME conference happening September 13th to 14th at the Drake Hotel in Chicago. Engage in leadership programming, learn negotiation skills, receive on-site coaching and mentoring, and see who will win this year's I Stand With Her awards. This year, we're excited to offer unique programming that includes a special session on how using improv comedy can bring fun back into medicine. We also have financial sessions tailored to help you navigate the complexities of personal and professional finances. Discover ways to advance into leadership roles, combat burnout, and either reignite your love for your current role or find joy in a new career path. Don't forget our Friday evening gala, a highlight this year you definitely won't want to miss. Register now at womeninmedicinesummit.org and be part of the movement that is shaping the future of healthcare. Join us to network, learn, and celebrate the power of women in medicine.
Are you a healer, a fixer, or a scientist? As doctors, we often develop a pseudo-identity. For me, as an emergency doctor, I identify very highly as being a fixer. You come in with a problem, something's broke, and I fix it. The concept of being a healer sounds a bit foreign, but the longer I do this job, the more curious I am about cultivating that part of my identity as a clinician, as a healer, because so much of what I see, I can't fix. And that is when healing can really enter. I'm really thankful for my guest today, Dr. Nikki Tugnet. She is a UK-trained rheumatologist in public clinical practice in Auckland, New Zealand, and a therapeutic yoga teacher. She is also a lupus researcher and is a member of one of the world's biggest lupus research groups, the Asia Pacific Lupus Collaboration. Nikki is passionate about sharing the system of yoga so that people with health conditions are better equipped to navigate stress, manage pain and fatigue, and maintain quality of life. She believes in the whole person healthcare, self-advocacy, and movement as medicine. Nikki integrates her role as a rheumatologist and as an accessible yoga teacher by specializing in yoga for arthritis and autoimmunity, providing online, one-to-one, or group class therapeutic yoga for health. She promotes yoga for all bodies, regardless of age, body shape, or medical condition, and provides a safe and supported space in which to explore the mind-body connection. Nikki and I cover a lot of ground in today's episode, and we ponder that question of, are we healers? Are we fixers? Are we scientists? And maybe we're all of those things, but what can we grow into and what feels good at this phase of our careers? This is also a fantastic episode if you are looking to do something different. Maybe you want to integrate yoga or coaching or meditation or nutrition or some other type of holistic approach to augment the wonderful medical care you already know how to give. So we'll explore that in today's episode. Welcome to the Revitalizing Doctor podcast. We interview trailblazers in medicine that embody the Revitalize Women vision to empower women to innovate and influence medicine, to value authenticity, respect, and work-life harmony. We recognize the challenges in medicine, and we're committed to providing coaching-informed strategies to help you go from surviving to thriving. I am so excited today to have Dr. Nikki Tugnet on the podcast. I'm going to be honest with you listeners, I don't know Nikki very well, and she resides in New Zealand. So I'm very excited to bring her to all of you, learn more about practicing medicine and yoga from New Zealand. So Dr. Nikki, it's great to have you on the podcast.
Hi, thank you so much for having me. I am really happy and excited to share a bit about my story and hopefully have great conversation about all things medicine and yoga. So thank you for having me.
Yes, this is such a joy. And for our listeners, it's 2 p.m. in the afternoon here. What time is it for you?
It is 9 a.m. here in Auckland, New Zealand.
The following day. So I always like to joke when I'm doing an interview with my friends in Australia and New Zealand that you're coming to us from the future.
Oh, yes. And the weather's not great, let me tell you, in the future, but it'll be okay, I'm sure.
Awesome. Well, if our listeners want to visit New Zealand, most of our listeners are in the US. What's the best time to come to New Zealand?
So if you're looking for snow and skiing right now, anytime between June and August, which is our winter in the Southern Hemisphere. But if you don't want snow, if you want to just discover the natural greenery, the scenery, then please come when it is kind of Christmas time. So December, January, February is summer down under. So summer in New Zealand and Australia. And it's the best time to take road trips and explore. And we're very, very blessed to have lots of kind of natural, safe pools of water, bodies of water to swim under, waterfalls. And there is nothing nasty here. No crocodiles, no sharks, no snakes. So you'll be safe.
That is so interesting because Australia is quite the opposite, right? There's many different spiders and snakes that can be quite treacherous.
We always like to joke that everything nasty basically went over to Australia with lots of love to our Australian friends, but there's literally nothing poisonous and nothing venomous in New Zealand. So it's like a miracle of nature. When the continents divided, somehow everything that was a bit dangerous went the other way.
Fascinating. Well, we're going to have to come back around to this when we start talking about yoga, because now I'm sure there's even more listeners that are interested in coming to New Zealand and hopefully getting to practice yoga with you. Can you tell us a little bit about your background, where you're from, how you became a doctor, and then later we'll explore how yoga entered?
Yeah, sure. I'd love to. So you can probably tell from my accent that I'm from England. So I'm originally born and raised in England, did all my training, including my rheumatology specialist training in England. And I relocated to New Zealand in 2016. And I've been here in Auckland ever since. And in terms of my background, I'm from a family of, I guess, travelers. So my parents were born and raised in India. They migrated to England in the 1960s. Obviously, I was born and raised there. And then I decided to migrate over to New Zealand. So I think I just have that natural traveling bug in my blood. And the family was my upbringing was quite instrumental, I guess, like many of us, in me choosing my medical path. So my family operated a business which was rented to a complementary health company. So I basically grew up seeing things like acupuncture and homeopathy and Chinese medicine being performed in the business next door to where we lived. And so it kind of piqued my interest at a young age to see people working with practitioners in order to feel better. And as I was growing up, it was kind of a big passion for my family that somebody in the family grow up and be a doctor, because nobody was in the medical field. And, my first memory of receiving a book when I was a child, when I was about 5, I think I got a medical encyclopedia. I didn't get any of those Roald Dahl novels or, fun fairy stories. I got this medical book. So I think I may have been indoctrinated, but actually it was a good thing because I enjoy what I do. And then so I kind of grew up thinking, yep, I want to go into medicine. I knew always from a young age that I had an affinity for helping with healing in some form. And I use the word healing in a really broad sense. I don't mean specifically by administering medicines or surgery, but just in holding space, in just being present and listening to somebody share their story. That has a powerful healing effect. The therapeutic relationship itself is healing. And so I think I always recognized that as part of my personality. And it also was a big draw to go into medicine for that reason, because of course we get to work with people one-to-one. We get to help people one-to-one. And primarily for me, I'm a person who really enjoys people. I enjoy developing relationships, and I enjoy watching people as they journey over time. So of course it made perfect sense to pick a specialty like rheumatology, which is all about chronic disease management. And effectively, patients stay with me from the moment they're diagnosed. They stay under my care unless they move away or they pass away. And so I get to be part of the journey, watching them, getting pregnant and getting married or getting divorced, going through bereavements, all of the big things in life and how that impacts their health. So I love that because it's a real privilege to be able to share in that journey and to watch people who, they may be 18, 19 years old, diagnosed with lupus, and how they live with that condition and how they, get through things that a lot of us take for granted, like going to university or, passing your driving test or having a girlfriend or a boyfriend or whatever. So yeah, relationships matter to me. Chronic disease management matters. And of course, rheumatology is just a fantastic blend of basic science and immunology and clinical work. And really the last 20 years, the whole game has changed in rheumatology because of all the therapeutic interventions that we have, all the pharmacological interventions. So now being a rheumatologist is just fantastic, really, because you get to help a person get their quality of life back and lead a fairly normal life. Whereas maybe 30 or 40 years ago, there was probably not a lot we could do for people with severe life-threatening, organ-threatening rheumatological conditions. So I love the fact that everything has changed. And for me, it's a specialty where art and science, they really do interweave very beautifully. And you can make a huge difference to someone who's living with arthritis or autoimmune illness. So that's kind of my background and how I ended up specifically in rheumatology. And then I guess I could share with you next about how or why I went into yoga.
Stay tuned. We'll be right back. Are you a physician mom with school-aged children feeling utterly exhausted? My friend Dr. Sheeta Shaffi invites you to take a little time this summer to join her in a small, intimate group for meaningful conversations. Dr. Shaffi is an emergency physician, coach, and mom to 8-year-old twins. She understands firsthand what you're going through. This isn't a pizza party or a yoga class. You'll meet for 2 one-hour sessions twice a month starting in July to help you move out of exhaustion, let go of mom guilt, and live a life you're not only proud of, but can truly enjoy. Connect with her on LinkedIn or Instagram at Sheeta Shaffi to learn more. Sheeta is spelled Shideh, and Shaffi is spelled Shafie. You can also check the show notes for a link so you can connect with her there as well. Yes, please. And I also want to come back to why you feel rheumatology has that blend of art and science. Could we maybe go there first?
So you have, obviously, in the past 20 years now, because of all the research that's been done to explore different pharmacological agents like biologic medications, anti-TNF drugs, we've got a really firm grasp, a firm understanding of the kind of molecular pathways, the basic science there, the underpinning of why inflammatory conditions occur. And so if you are so orientated, you could go into rheumatology and have a very sort of basic science orientated practice, a very academic practice. You could spend most of your time in the lab researching this if that was your thing. And the reason I call it a blend of art and science is because I'm so people orientated. I really do enjoy listening to the person's story and understanding how those symptoms impact their physical life, and then seeing what I can do to help them to manage their symptoms in a way that is more than simply giving medication. So therein lies the art. What are the things that I can do to help them, or what are the techniques I can teach them even to help them have some agency in their lives over their condition, which is separate to the pharmacological stuff that I'm going to offer them. Does that make sense?
It makes total sense. And do you know Cherie Johnson by chance? Have you heard her name?
I haven't, I'm afraid.
So she's a psychologist and physician coach in Australia. I believe she lives in Queensland. I took her Recalibrate program and we talked about how you identify as a doctor, and I think as an emergency physician in the United States, many of us identify as being fixers. And a fixer is you have a problem, you come in, I fix it. And somewhere along the way, the healer, at least in my doctor story, has kind of gotten lost. Like I don't feel like I'm healing people very often in the emergency department. There's moments that I think kind of healing enters in. And then I've been trying to cultivate that more. So this was an unexpected tangent, but I think it's actually really important. Could you give an example of how you weave in that art, that healing component obviously we know you can write a prescription for, an immune modulating agent, and that is a form of healing, but that is also very basic science oriented. What's the healing part that you do?
That's a beautiful question, and I could probably talk about this for a long time. So I'll give you the overview of how I kind of work. I generally work one-to-one with people. And so even if I'm not seeing them in a medical setting, in a clinical practice setting, I generally work with people one-to-one in the yoga setting as well. So the healing aspect really depends on the information they give me. So I do basically a thorough intake with them, and I will inquire about things like, what is your sleep like? What kind of support do you have at home? What's your community like? What structures do you have in place to deal with the fact you've got this chronic autoimmune condition or this chronic pain condition? And then based on the information I receive, I can then come up with specific things to help them. So one example I'll give you, I recently have been working with a client who's got scleroderma, which, if your listeners are not aware, it's a pretty rare autoimmune condition. It used to be called systemic sclerosis, but it's basically a kind of connective tissue disease where all of our collagen fibers, there's an excess of collagen fibers. So basically people get very thickened, very tight skin, which can often lead to joint contractures, lots of pain, a lot of fatigue, as well as internal organ diseases like interstitial lung disease. And so you might think at first glance, well, what can you do about that? Apart from giving strong medications for the immune system, what additional healing techniques could there be? But what I've found specific to scleroderma is that myofascial release, so working with the patient to help them understand tender or trigger points within the body where the fascia is particularly tight, and teaching them how to self-myofascial release or self-massage using like a massage ball or a tennis ball is really helpful. It is super helpful, not just for relieving pain in that part of the body, but also there's some emerging evidence that it might help with even skin softening and flexibility where your skin has got very tight and contracted over time. So over a period of years, we're talking not weeks. So that is a kind of relatively simple little healing technique that once a person has been empowered and they know what to do and they recognize the sensations in the body so that they don't induce pain and they don't induce stress in the body, that's something they can do on their own. So it's a small example, but these are the sorts of things that we do all of the time. Another one might be, I'm a big fan of traditional Chinese medicine, so I tend to interweave that with my yoga. I might, if I see a patient in front of me who just looks really anxious, really stressed, I might just teach them, and you may have seen this, but tapping plates.
No.
So there's a therapy or modality called emotional freedom release, EFT. And the sort of nickname for it is tapping. And essentially you've got these two acupressure points underneath your collarbones, underneath your clavicles, which in Chinese medicine, these two acupressure points are calming points. So it's very simple to teach somebody to tap on their own sternum and under their clavicles. And once they learn how to do that, whenever they're faced with a period of overwhelm, they can just start doing this for 1 or 2 minutes, and they immediately will lower all of that circulating cortisol and that sympathetic overdrive that many of us exist in, particularly if we have chronic pain or chronic illness. So they're just two little examples of some of the kind of what I think is self-healing. Rather than me healing them, it's more about empowering them to heal themselves or giving them the tools to heal themselves as a complementary or an adjunct to whatever their medical or their conventional medical treatment may be.
I love that. That's so beautiful. I feel like every doctor listening needs to know that for their own well-being and, like you said, to empower patients. And certainly there's so much societal stress and overwhelm right now. I think we could all be doing some of that self-tapping. So where did yoga enter? Did you do yoga as a small child and it was just throughout your entire life, or did it come in later?
It came in a lot later. So I probably came into yoga when I was around 30, 31. I'm 43 now. So it's been about a decade since I came into yoga. So I didn't actually grow up with yoga as a child. But like many people who are drawn to yoga, I went to it in a period of profound burnout, profound stress. It was probably back in 2014. There was a sort of breakdown of relationship, severe stress from workload. I was sort of a newly qualified consultant, or you would call it an attending in the US. You've reached your peak of medical specialism. And it's not quite what you think it's going to be. The experience is quite different and quite overwhelming. And so I was really quite profoundly burnt out. And at that time, I was looking for anything to help me feel just more relaxed, actually. And so I picked up yoga quite casually, maybe once a month or something, not too intense. But from there, my interest was piqued. And so I then sort of took myself away on this week-long yoga retreat overseas. And that's what really got me passionately convinced that I had to keep up a yoga practice on a regular basis. Because I guess if you go on a yoga retreat, all you do is yoga. You're doing 2 or 3 practices a day and you have no other distraction. So you really can draw inwards and you can sort of really journal and connect with yourself without distraction. So from there, I relocated to New Zealand in 2016, as I mentioned, and that's it. I was just a yoga convert. I was going to yoga studios maybe once, usually twice a day, like a morning class at 6 o'clock in the morning and an evening class at 6 o'clock in the evening. I just was kind of addicted to yoga, if you like. And I guess in the past, 3 or 4 years since we've all gone through this really weird COVID time, it was the trigger for me. It was the absolute trigger that told me that I need more. I want to offer more, but actually I want to learn more yoga in depth for myself. I need it. The anxieties of living in those times early on in the pandemic where we didn't really know what was going on and rules were changing all the time. Guidance was changing all the time. And I'm sure, you and probably most of our medical colleagues can relate that it is hard to be the person that, your patients look to you for guidance and for reassurance. And when you don't feel reassured and when you don't feel like you know what's going on, it is doubling the imposter syndrome because you have to almost pretend that everything's going to be okay and you don't feel it. And also I was pregnant in the height of the whole pandemic in early 2020. So I think pregnancy will naturally induce some anxiety, even in most people. So yeah, that was the trigger. I just realized I cannot carry on in this pure medical model way. I want to be able to offer more because I constantly am hearing from patients that, they want to talk, they want someone to listen to, they want other ways apart from pills that they can help themselves. They want agency over their symptoms. They don't want to just rely on take this methotrexate once a week and do this lab test. They want more. So that was the trigger. And as I say, I took a sort of a basic foundational certification training. We call it 200-hour training in yoga. I did that in 2022, actually. So beginning of last year, January last year. And then from there, I then got on to do my more advanced teacher training as I'm kind of deepening my knowledge and learning other holistic skills to work alongside the yoga. So that's why I've got this interest in myofascial release and acupressure, the tapping other modalities, because they all nicely complement each other. And it's good to have lots of different tools in your toolbox that you can offer somebody as they need. So yeah, I'm relatively new to yoga. To summarize the answer to your question, it's only been a decade, but I think that once you find the type of yoga that really draws you in, because let's face it, there are probably hundreds of different styles of yoga and yoga classes and millions of yoga teachers. But once you find that style of yoga that resonates with you, then it actually is hard to walk away from it. It becomes almost like an addiction. And I think probably a lot of us medical practitioners, we can be workaholics. We can find something that we really enjoy and then keep on doing it. And, yoga, I guess, is my new healthy addiction, if you like, I hope.
Yeah. And no, it's fantastic. The critique I hear the most about yoga, and honestly from a lot of doctors, is it's too slow. I don't have enough time as is. So if I'm going to work out, I'm going to run, box, bike, do something that I burn a lot of calories. I've been to some hot yoga classes. I've done some yoga that involves weights. So I would counter that there are plenty of yoga classes out there that can burn a ton of calories. But I'm just curious, when you hear that, what your response is, because it seems like a lot of doctors resist coming out of a pure sympathetic type of exercise.
Yeah, absolutely. Such a great observation. And I concur. I hear the same things when I talk about yoga to my colleagues here in New Zealand, for example. There is that general perception that if I'm going, I think you said it very clearly, if you're going to exercise and you're going to work out, then why yoga? Why not go box? Why not go to your HIIT class or your F45? So I would caveat that by saying the misnomer or the misperception is that yoga is an exercise or that yoga is a workout. So that is the real crux of the issue. And I spent a lot of time educating and highlighting to people about what yoga really is. So when yoga was developed thousands of years ago, 5 or 10,000 years ago, the physical component where we stand in those postures, it didn't even feature in it. It was all about being able to meditate for hours on end. It was all about trying to connect with the breath, connecting the mind, the body, the spirit, the breath. And there was a recognition that if you did that thousands of years ago, it would help you lead a more ethical life, a more moral life, and it would help you have a stronger internal awareness of your own health. And then you could optimize that. The actual shapes, the yoga asana, we call it in Sanskrit, the yoga shapes, that literally only came about probably in the last 100 years. So that's a very new addition. But in most Western countries, the yoga shapes and the postures take predominance. That's what you tend to find when you walk into a yoga studio or you go into a gym where they offer yoga classes. But the reality is, if you want the benefits, the health benefits of yoga, if you want to balance out the fact that you're always in that sympathetic overdrive, you need to slow it right down. So when you practice yoga, yes, we'll be doing some physical postures, but that won't be the main thing that we do. We'll be really honing in more on the breathing. So we call that pranayama. We'll be honing in more on meditation, on mindfulness, and on more subtle yoga movements. So that is the antidote to being in the sympathetic overdrive. And we know this now from increasing yoga research that if you're practicing things like yin yoga or restorative yoga, which is very slow, very subtle, very gentle, you're definitely not going to burn lots of calories. That is far more sort of helpful for getting you into that true active relaxation. So parasympathetic activation, increasing your vagal tone. That's far more helpful. You're not going to get that in a power yoga or a hot yoga or a very strong moving yoga practice. So I always like to highlight that part, that yoga is more than just a physical exercise, and it shouldn't really be thought of as a workout or as a fitness modality. I know it has been kind of interpreted as that. But actually, if you go back to the roots of yoga, it was never developed to make you physically fit. It was never developed to get your cardiovascular fitness up. It was more about slowing down. And I think that's because there's an ancient indigenous wisdom that recognizes that slowness and slowing down in general is essential for a healthy life. And we've forgotten that because modern society is all about do, get this done, tick it off, next thing. And we have forgotten how to just pare things back and do nothing, but literally do nothing, because we're always multitasking. So doctors, I would argue, and myself included, we are the ones who really need that form of more subtle, slower yoga and mindfulness and breath awareness, not instead of your boxing and your fitness. No, please do all that. Do your high intensity stuff. But if you only choose those sorts of exercises, then you're only really going to exist in sympathetic overdrive. You're never going to enter that sort of active relaxation state, which we need to be in for healing, as you know, for repair, again, yogic research is showing that the more we practice those more subtle aspects of yoga, the less physical aspects of yoga, the more we help with depression, anxiety, we help arthritis, we help back pain. There's evidence in Parkinson's, in reducing falls, in neurological disorders, in diabetes. The list is endless. There are so many health benefits of slowing down how you practice yoga and taking the emphasis off it as a workout and more as a mind-body modality that will optimize your health.
So beautiful. And I think that's going to resonate with so many people. I have one close friend that's a physician that has done her yoga teaching certification as well. And I think there is a growing number of doctors, I know that's why many of them tune into this podcast, that feel very frustrated with the current medical system. Many of the points that you've articulated, that I've said it many times on the podcast, that there's this saying that you see these babies coming down the river and, early on in your training, you're just kind of plucking them out. And then most of us get to this mid-career phase where we're like, this isn't really working. Like, we need to go upstream. We need this more holistic approach to really heal people. And so, at least from the United States, the medical system is not set up to do that. And so many people are starting to maybe leave traditional practice and create their own practices. And so I'm curious if you could paint for the listeners, and obviously the system in New Zealand's different than the United States. So New Zealand has government healthcare, correct? Healthcare is included. Okay. So how much of your patients do you get, is there a percentage that is that traditional, you see people through the government, or is everything private practice? Is there private insurance? Is it all direct payments? How does that work?
So in New Zealand, I would say probably 80% of people will use the public healthcare system, which is all government funded, and maybe 20% prefer to use insurance and see a private practitioner. But healthcare is available for all New Zealand citizens and permanent residents. It's available. I work fully in public clinical practice at this stage of my life. And so when I see people in public clinical practice, of course, the emphasis is always going to be on the conventional standard of care. There is no specific time allocated by my institution for me to deliver, this other side of care that we've been talking about. So I will drop in little pearls here and there in my clinic settings. I will offer some small things. I can teach you some simple exercises in a couple of minutes, but I'm obviously not going to go into full detail. So when I offer therapeutic yoga for a health condition like arthritis, that will be done completely privately. So that's done as a separate business entity, which I offer, which unfortunately is not yet funded. So yoga therapy or therapeutic yoga is not yet funded in New Zealand, not like, for example, physiotherapy or occupational therapy. And I think that's different to the States, because I have some friends in the States who are working as yoga therapists, and some of them have managed to they are working in institutions, in hospitals. So I think it is more increasingly recognized that therapeutic yoga has a role to play in creating and maintaining health. So it is a real struggle at the moment in New Zealand, but hopefully time will change these things. Just coming back to something you also said about younger junior doctors, full of energy, full of enthusiasm. By the time they get to our stage, maybe some of that enthusiasm wanes for the medical system. I fully agree. And I think that if we want to produce more practitioners, more clinicians who deliver this whole person healthcare approach, which frankly, I think the world needs, we need to be targeting and teaching at a young age. In Auckland, where I work, we have a medical school here at our university. The students actually do have one module, which is all about complementary modalities. Now, I can't speak to how in-depth they go. I don't even know how much yoga plays a part in that. But it is nice. It is promising. It is encouraging that at least there is a module highlighting that people are recognizing that people are seeking more than just the pills, the surgery, or the psychiatric intervention. Not that there's anything wrong with that, but people want more. So that's, I think, where it starts. But I would go so far as to say that when you're a junior doctor, no matter where you work, I think every junior doctor should be introduced to the techniques of mindfulness and breathing techniques and yoga as a junior doctor, and it be continued throughout your training career so that it becomes a unconscious, automatic skill, a bit like you and I will pick up a stethoscope and will automatically know where to listen to the heart sounds and what sounds abnormal. So if we want to normalize whole person healthcare, then this is how we do it. We can't expect a doctor to get to the age of 40 odd, have a hallelujah moment, a light bulb moment, and completely pivot their career, which is what most of us are doing, where you're doing, I've done, which is all well and good, but it would be beautiful for the public. It would be good for people if we learn all of this at a younger age. It would be good for our own well-being. Our careers still have, one of the highest rates of burnout, and I think that's getting worse. So we all need help, not just the public, but we do too. And I think that these mind-body modalities are the key, actually.
Absolutely. And the evidence is overwhelming. The functional MRIs, people that meditate, we have to be doing this. And honestly, I'm watching more and more patients, that come in so untethered, and they don't really have any basic skills on how to handle even very minor incidents in life. And that this needs to be taught in elementary schools. Yeah. I wish we would be teaching, stretching, breathing, just some of these self-soothing skills. So, and doctors included. I remember there was a mindfulness program at my medical school, but it was after hours. And I was like, I can't do one more thing, but I regret in some ways, I wish I'd had it earlier. And I'm trying to talk to the residents I work with is, now as I'm approaching my 40s, trying to relearn, develop new neural pathways, which of course we can, neuroplasticity. But I think if it had started earlier, it would have been a better experience to have more of those skills early on. And yes, the system needs to change, but it's not going to change overnight. So while we're working in it, if we had more of these skills, our day-to-day would be a little bit better.
I fully agree. And I just, on your point about, rewiring neural pathways and neuroplasticity, yoga and myofascial release, these are amazing modalities for that. So again, there's, even more benefits to practicing and doing yoga. And you mentioned that system isn't going to change overnight. That's true. But, we are the system, right? Us as individuals, collectively, we make up the system. So the more of us that become better equipped to self-soothe instead of distract ourselves from difficult emotions, complex traumas, life obstacles, which we're all really good at, myself included. But the more we can self-soothe, the more that we can acknowledge our own emotions and the impact of emotions and life on our physical and mental body, the faster the system changes.
That is So beautifully said. This is just, again, I'm going to say Cherie's name and I'm putting it into the universe that your path will cross with her. She talks about this a lot when she interacts with doctors. And it can be kind of frustrating for doctors to hear because I'm not gaslighting anyone. The system is quite dysfunctional and abusive, and we've lost doctors. They've committed suicide. They've had their lives ruined. So I'm not saying any of that is okay. But we also have to acknowledge the agency that we have. And literally, the system can't work without us. The more of us that are able to stay well, and that's what I always tell people, you have to put your own oxygen mask on first. So whatever you need to do, if that's cutting back, work will still be there. And the more of us, like you're saying, that can transform this system. So what are some tangible tips you could give somebody if they are very new to yoga? Maybe is there one pose or one thing they could do? I mean, so many of us, unfortunately, sit at our desks. What's something that maybe we could try out?
So, I mean, I teach a lot of chair-based yoga or desk-based yoga because particularly the people that I work with, a lot of them have, or most of them have some form of arthritis. So they often can't get down to the floor very easily. So, there are lots of simple kind of relative stretches we can do in a chair. But I would probably say that if there's one pose that everyone should be able to do, I think I'm beg to say it should be Savasana, the resting pose. It's also known as the corpse pose, which is the shape that we always end a yoga class with. Mm-hmm. And I'm sure you're familiar with it. And you might be thinking, well, isn't that just lying down? What's so special about that? The reason I think that is the shape that everyone should learn is because having now watched thousands of people in their Shavasana, when I guide them into it, I see what a struggle it is for so many people to switch off mentally. So you will see, as you will know, in the resting shape, in the Savasana shape, we are meant to be lying in complete relaxation and in complete stillness without any fidgets, without any movement, just actually fully relaxed. And it's a symptom of our society that actually so many people cannot lie fully relaxed. And it's not because of physical pain. It's because of the monkey mind, the chatter that's going on internally. So I think that's actually the best place to start. Start with the ability to fully relax, not fall asleep, and to, lie supported with props. Make sure you're comfortable. If you can do that for 5 minutes every day, that's quite a great way to start your yoga practice. And then if you are looking to do something more physical, perhaps sitting in a chair, you can you can probably do it with me right now. You can hold on to the bottom of your chair with your chair seat with one hand, take the other hand up into the air, and you can bend over. And then you can open all of your side body here. So it's like a simple little thing. You can look up towards the ceiling. And the deeper you send your top hand towards the opposite wall, the more you open up along these obliques and, our lats and things like that. So just a simple chair-based yoga.
I love this. I'm going to be encouraging my residents while we're on shift. Let's do some chair-based yoga. Good for our bodies and our mind. I did think of a question. And I know some of it, obviously, this is not a legal podcast. Please consult your attorneys, blah, blah, blah. And I know it's a little different in New Zealand than the United States, but could you at least give a frame for how you interact with people that want to work with you about whether you're treating them as this is a doctor-patient relationship or this is a yoga instructor to yogi customer? Like, how have you divided that?
Well, I've divided it for a number of reasons, but so when I work with people from the yoga perspective, I'm very clear in my communication that when you come to see me as a therapeutic yoga teacher, that's who you're seeing. You're not going to receive prescriptions or lab tests or imaging. You're not going to get a diagnostic workup. I'm not going to say, oh, you've got ankylosing spondylitis. That's not my role in that particular setting. That's quite clearly conveyed to them. But obviously when they're talking and I'm doing an intake with them, so just to break it down, when somebody wants to work with me, I always do a very detailed, it's usually about 75 minutes. I do a full-on intake, which is really similar to, I would say, like a new patient consult if you're in an outpatient clinic. So we're going through physical symptoms. We're going through physical assessment as well, and looking at a range of motion of different joints, different muscles. I'm looking at gait, posture, all of these things. But I'm also asking about, stress levels, digestion, nutrition, water intake, sleep hygiene, community, all that sort of stuff, which ideally we would ask in a medical consult, but I don't know if we always do. So I also layer that in. And then once I've completed all that, I then work with them to figure out what is the areas they want to focus on. So are they looking for stress reduction? Is that their primary goal? In which case the yoga program that I put together will be quite different to somebody else who says, actually, my main issue is I've got hip pain, and I've got hip pain because I've got trochanteric pain syndrome. All right. So I know I need to work on maybe some clamshell exercises, some side lying leg lifts. I need to do other things to help those hip muscles. Another example would be somebody who's got rheumatoid arthritis, and maybe their problem is mainly their fingers and hands. They've got a lot of pain there. What can we do? What specific yoga asana can I do to help with the hands? All right, well, we'll develop that. So what I'm getting at is that it's always individualized when you work one-to-one, because it has to be, because everybody's unique. So just like medicine, just as a rheumatologist, whatever prescription or whatever therapy I refer you for as a rheumatologist for your rheumatoid arthritis is individualized. It'll be the same approach when I'm seeing you as a yoga teacher. But I do draw that clear boundary because I don't want to mislead people. And I want my clients, my yoga clients, to have a clear understanding of what they're going to get when they work with me. So I think that's important because in New Zealand, as I say, yoga therapy is not funded. Again, people are going to be, buying that service, purchasing that service. So they need to know that you're not actually buying the medical time. You're not buying a medical provider's time. That's a little different. So I hope that answered that clearly.
No, I think it's really helpful. And I think, obviously everyone should consult their own, business, people, lawyers, all that kind of stuff. But, when I think about when I've gone to a personal trainer, they're asking me about my hydration. They're asking me all of, similar questions. Obviously, they've had variable levels of training. It's an unregulated industry. So I think sometimes some of the doctors I've met have I think they put limiting beliefs and not really started their business or done something because they're kind of too caught up in potential medical legal risk. And I think the way you drew the distinction, and even your logo says Yoga Nikki. So you're not using your doctor label in that. And so as long as you're explaining it to people, and what's clear is kind is clear.
Yeah, I love that.
That's a Brene Brown one.
Yeah, I agree. I think that clarity is important. I will say though that, when you are a yoga teacher or, let's say you're a PT or a yoga teacher, but you actually have a medical background as well, and you have a specialist medical background. So it is, I think it offers a lot of reassurance to the client. So a client can go and see another yoga teacher, but if that client has ankylosing spondylitis or that client has, scleroderma, which I mentioned earlier, these are not common. They're not common. And a lot of yoga teachers may not have worked with people like that and may not have confidence to work with people like that. So I think that your client feels more confident when they know that you will understand their limits. You will understand that maybe they've got, ankylosing spondylitis. They'll probably have fused sacroiliac joints and there's certain movements they can't do easily. So it does come in really handy, even though I'm not setting myself up as a rheumatologist seeing them. I'm seeing them as a yoga teacher. I think a lot of, in my experience, my clients find it really reassuring that I am a medically trained specialist. And so I do understand some of these rare conditions that they've got. Because as you know, rheumatology is a very great specialty. It's very rare and wonderful conditions in there that most people won't encounter in everyday life.
I love that. And I really think that's something our listeners should think about. I think sometimes we get so used to our level of expertise and we sometimes blow it off. And we're often encouraged to be humble, which that's great. But you do have a unique lens. I'm thinking of my friend with her yoga instructor status and, she's epilepsy fellowship trained. That's a very niche area and certainly, a great area to explore how those patients may benefit. Well, it's known to benefit from yoga. I am curious. I'm guessing there's some listeners that maybe are thinking, well, I would want to work with yoga, Nikki. I have a family member that has an autoimmune condition and that's really struggling. Do you work with anybody online?
Yeah, I do. Thanks for asking. So I actually work predominantly online. I work one-to-one therapeutic yoga for anybody who needs it, but especially if you do have autoimmune or arthritis. Given that I've got 20 years experience in that field from rheumatology, I feel very, very comfortable going through that with you via Zoom. So I generally work one-to-one online via Zoom, and that can be with anyone in the world as long as we work out a time zone that fits both of us. That's no problem. I also offer a weekly specialist yoga for arthritis and autoimmunity online class. And again, anyone can join in from the world. It's held at Friday, 12 p.m. in New Zealand time, which I think from memory is usually something like maybe 5 or 6 p.m. Eastern Standard Time in the States. I think it works out pretty well for most parts of the States, maybe not the West Coast, but it's always a difficulty with New Zealand because we're so far away from everyone. So most of the work I do offer is online. Obviously, if you're based in Auckland, you can also come to my little studio, which is behind me. It's I work out of a little home studio. I would welcome if you have, family members or friends or yourself, if you are curious about how to use yoga specifically for, health issues or particularly for autoimmune or mobility, arthritis challenges. I'm really happy to speak to you.
Yeah. And do you also speak to doctor groups? Like, would you be willing to do grand rounds or speak to like a group of residents, giving them a primer on how yoga could be beneficial for themselves and their patients?
Yeah. So I have spoken quite a lot to patient groups. I've spoken to sort of the equivalent of Arthritis Foundation in the USA, our version is Arthritis New Zealand. So I've offered quite a lot of specifics about yoga for pain management in arthritis and lupus. And I'm very happy to kind of talk to colleagues, medical colleagues to help them understand as well how yoga can make a huge difference in the lives of yourself and your patient.
I love this. Well, this hour has just flown by and I feel like we've only scratched the surface. I feel like a lot of our listeners are going to want to connect with you. So how can they reach out?
So I'm very happy to share my details with you, but my website is probably the easiest way to connect, or social media. So my website is yoga doctor spelt DR, Nikki.com, yogadrnikki.com, or on social media, you can find me on Facebook or Instagram. And I'm under the handle of Yoga Doctor spelt fully, DOCTOR, so Yoga Dr. Nikki. Just to confuse things.
Wonderful. And I will put all of those in our show notes. Anything else you'd like to share before we wrap up?
I would just like to say once again, thank you for having me. And if you are a listener out there who's thinking about, adopting a kind of a mind-body practice or a complementary therapy alongside your medical career, or maybe even instead of your medical career, can I just say, yes, please do it. The world needs more whole person healthcare, more holistic practitioners like you. You have the power to help people find agency over their own symptoms, over their own body. And please do, if you are going to do that, please do make sure that you get a proper training in whatever it is that you're training in, whether it's nutrition or PT or yoga. Go get some reputable training and just do it because it'll change your life.
Oh my gosh, that is such a beautiful call to action and such a great link to what we're doing here at Revitalize. Myself and Linda would love to connect with anybody out there that's thinking about doing something different. I mean, you became a doctor. Most of our listeners are doctors. So you've already done something really hard. So this next chapter, think about what's lighting you up and what the world needs, your ikigai. And if you don't know what that is, I'll be happy to have a call with you and see if we can get more things to line up, because the need is great. There is a lot of suffering in this world, and all of our listeners have a unique lens and skill sets, and we want you to be happy while you're doing it. And I hope some of our listeners will check out your Instagram or Facebook and maybe even a quick photo from this session, because you're glowing. When you said you were burned out a few years ago, there is nothing that I see burned out now. You're just exuding calm, serenity, and a real presence. So it's been a joy getting to speak with you today.
Oh, thank you so much. I really have enjoyed our chat. I've really loved every minute. And again, thank you again for letting me join you today.
Thanks for listening to The Revitalizing Doctor, a project of Revitalize Women Physician Circle. Our mission is to connect women physicians and allies through innovative, value-based coaching methods that align trust, support, accountability, and skill development to ignite the courage and clarity necessary to take bold actions, create change, and thrive. If you're interested in working with us, check out our website at peoplealwayshcc.com/revitalize or email us at revitalizemm.info@gmail.com. This podcast represents the views of our host and guest. It does not reflect the views of any institution we work for or with.
Hi, it's Dr. Risa E. Lewis, dropping in to tell you about a book that Dr. Adara Landry and I wrote. It's called Microskills, Small Actions, Big Impact. It's a business self-help book coming in 2024 by HarperCollins. Pre-order now. Microskills, Small Actions, Big Impact, wherever you buy your books.